everyone. Welcome to the Health, Hospitals, and Social Services meeting. We have a few guests here to talk with us today about COVID and meet a new person as well on the Metro Public Health Department team. So just quickly, we have a quorum. We have two areas that we can take all together in two different areas, and then one that we'll take, and then two others that we'll take by themselves. But Metro Action Commission will take two of those together, and then all of the MPHD resolutions, we'll take those together, and then we'll have a late resolution filed by Councilmember Stiles and a social services resolution that we'll take by themselves. So what I would like to do is I'll move the Metro Action Commission items and then take a vote. I'll let Ms. McCready give us a quick update. If there's any questions, we can have discussion on both at the same time. Thank you, I will. All right. So we're going to take these two, RS 2021-1087 by Swore, Toombs, Taylor, and others. A resolution approving grant from the U.S. Department of the Treasury to the Metropolitan Government, acting by and through the Metropolitan Action Commission to be used for emergency rental assistance in accordance with the purposes set forth in Section 3201A of the American Rescue Plan Act of 2021, RS 2021-1088 by Toombs, Taylor, and others. A resolution accepting a Summer Jobs Connect grant from the Cities for Financial Empowerment Fund, CFE Fund, to the Metropolitan Government, acting by and through the Metro Action Commission to implement a comprehensive financial empowerment program that provides participants with access to safe bank or credit union products. I'll move those. Do we have a second?
Second.
All right, it's been moved and properly seconded. Ms. McCready, would you please share those two?
The first one, 187, that is our ERA, or Emergency Rental Assistance Funding. It's additional monies that go with the $20.1 million that we already received, of which we spent about $16 million. We hit $16 million last night. And then the $9 million is this additional funding that we'll have available. You also probably remember that we will be working with several nonprofits after we finish the RFP process, which it has closed, and now it's in the review phase of the proposals that have been received. And then the second grant is a financial literacy grant that we have for the young people who participate in our summer programs, teaching them how to flip stocks and just how to reinvent themselves, how to save, and there's a re-engagement that happens over the summertime through text messaging, where they can make a pledge to make sure that they save. And so that's what those two grants are.
Any discussion? Madam?
Thank you very much. I appreciate everything that you all are doing. I know the rental assistance is very key. Will these funds, the additional funds, have the same restrictions as the others, or will there be some relaxation, which means that you'll be able to assist and help others?
We will be able to assist and help others. It does have some relaxation, meaning that it is pandemic related versus specific to COVID.
Right.
But then the funding behind that does follow the same criteria that we have currently.
Excellent. Thank you.
Yes, Councilman Porterfield.
Thank you, Chair. I just wanted to thank Mac for all of your hard work and everything that you all have done. It's very impressive how you all have outpaced other cities in the country with getting out this rental assistance. I think it's really important that the people of our city know and understand that even though sometimes like we may perceive something going a bit slowly, you know, you all have just gone above and beyond to try to get these dollars in the hands of people that need them most, and that you all are outpacing other cities around the country. So I just wanted to thank you all so much for your hard work.
Thank you so much.
Good deal. Any further discussion? All right, so we're going to be voting RS 2021-1087 and 1088. All in favor?
Aye.
Any opposed? All right, motion carries. So now, as I mentioned earlier, we have Metro Public Health Department, and we'll take all of these all at once. There are these 4 different items. RS 2021-1090 by Toombs, Taylor, Rutherford, and Welsh, a resolution approving the employment contract for the Chief Medical Director of the Metropolitan Government of Nashville and Davidson County, RS 2021-1091 by Toombs, Taylor, and Bradford. A resolution accepting a grant from the Friends of Metro Animal Care and Control to the Metropolitan Government, acting by and through the Metropolitan Board of Health, to provide funding for families experiencing difficulty maintaining ownership of their pets, to provide funding for the microchip clinic, and to provide funding for emergency medical care for shelter animals. RS 2021-1092 by Toombs, Taylor, Welsh, and Hurt. A resolution approving Amendment 1 to a grant from the Tennessee Department of Health to the Metropolitan Government, acting by and through the Metropolitan Board of Health, to improve the health of citizens of Davidson County through targeted strategies to prevent and control the use of tobacco. And RS 2021-1093 by Toombs, Taylor, Welsh, and Hurt. A resolution approving Amendment 5 to a grant contract from the Tennessee Department of Health to the Metropolitan Government, acting by and through the Metropolitan Board of Health, to improve the health of those residing in or visiting Davidson County through targeted strategies to prevent and control the use of tobacco products. Okay, those are on the floor. I'd like to make a motion.
So moved.
It's been motioned and properly seconded. Mr. Sharp?
Yes, sir. Well, I'll let you get to the director here in just a second.
Yep.
The two tobacco grants come from different funding streams, having slightly different programming, but they're essentially the same kinds of things. The Friends of Matt grant, they're wonderful folks. We very much appreciate that. One of the main reasons people give up an animal is it's sick or injured and they can't afford the care. This will help them with that. That was those three, right?
That's correct.
Okay, so Dr. Alice Jahanger, Chairman of the Board of Health, is also here. Dr. Gil Wright is here. I would think it'd be a good idea if you approved that contract, but he may have a different view. You'll have to ask him.
Well, good. So, committee, is there any committee discussion in regards to any four of these items?
Chair,
Okay.
if I may, I just think Dr. Wright has done a superb job leading through this and interim, director and being thrown immediately into it, right? So you were asked to pick something up and run with it right in the throes of things. And I know we asked that of a lot of people as it relates to the pandemic, but I've just been very impressed with your work and appreciate your willingness to serve. And I hopefully congratulate you after just a couple more votes here tonight.
Thank you.
Second.
Third.
And Dr. Jahanger has joined us.
Did you get my letter, Dr. Wright, that I sent today? Oh, okay.
Dr. Jahanger, do you have any comments on these bills?
No, listen, the main reason I'm here is, first of all, to thank all of you for, 18 months of amazing support. But the primary reason is to support Dr. Wright's contract. The Board of Health approved this contract unanimously. We believe Dr. Wright has done a great job. There's been some great moves. In the meantime, Dr. Stephanie Kong is with us here today. She is our new Bureau Director of Health Equity, because this is the priority of our department. It's something that the Board of Health approved this position literally right before the pandemic started, and we finally were able to hire the most amazing individual. We'll let her at some point talk about herself. But
Thank you. We'll introduce her.
But yeah, but I just want to thank you all. I know this department is committed to, and I believe an amazing future ahead of it. And so, thank you for your support of Dr. Wright, because that's a key portion of it.
Well, good deal. Thank you so much. RS 2021-1090, 1091, 1092, and 1093 are worth.
Take a vote.
Yeah. Thank you. Thank you. Thank you, Councilmember Hurt. As I was saying, those are the areas we're going to be voting on. Thank you. So, we have a motion and a second on the floor. All in favor?
Aye.
Any against? All right. Unanimously. Dr. Wright, welcome all the way to the team. We have two more items, and then we'll put Dr. Wright to work, actually. RS 2021-1094 by Toombs, Taylor, Welsh, Bradford, Allen, and Hurt. A resolution accepting a grant from the United Way of Greater Nashville to the Metropolitan Government, acting by and through the Metropolitan Social Services Homelessness Impact Division, to provide a framework for secure data sharing to collect client-level data, it's a lot of data, and data on the provision of housing and services to homelessness homeless individuals and families and persons at risk of homelessness. I move this resolution.
Second.
It's been moved and seconded. Ms. Tackett?
So this is really to, United Way is paying us to import data into HMAS from people and providers that are already entering into HMAS to cut down on duplicative entries, data entries. This is also exciting for me because this builds the platform that we can move forward with and work with Nashville Rescue Mission to get that data into HMAS with data imports. So that's, the contract is really, United Way is paying for it. So we're trying to set it up and make that happen for our community. So have a better picture and outcomes for people experiencing homelessness.
Any discussion?
I'd just like to know, so once this data is collected and is shared, what outcomes comes from it?
Yes. One, you know the number of, have a bigger picture of the number of people experiencing homelessness in an unduplicated annual count, which is right now not happening because we're lacking the shelter system, which is, most of the shelter system is National Rescue Mission. The other thing is we get a lot of pushback for, right now organizations that receive federal funding are required to enter the data, and that's it. So we get a lot of interest from more organizations to entering, but then the question is, we have this data system, we have this data system, and we do duplicative and sometimes triple data entry. This will cut that down. That's the goal of it. And then we measure outcomes based on what's the average length of time it takes to get a person into housing, how long are people experiencing homelessness, not just the number of homelessness, but it's really how well does the system function to actually get people to housing as quickly as possible.
Of course. Do all the agencies in the city, are they in the HMIS system? Are they using that same system? Are they, I know that we're working, but do they have access?
No, it's really very protected data. So it's mostly nonprofits that work specifically and have homelessness funding that function with that. And we are housed within the city, so, but it's not that any agency, it's not public information, it's really protected.
So the data that they receive, it doesn't integrate into a larger thing, okay.
No. It's because of the, protection of personal data.
Thank you. That's all the questions I have.
But will this system kind of capture that raw data at least, or?
Yes, and aggregate data is already, we're already putting that out there. Housing placement rates. We have that recent, you've heard a lot of talk about the goal to house 400 people by December. By the way, we've, by July, reached that goal. We're at 476. We're setting new goals for that. And that's kind of the data that comes out of this HMS, the Homeless Management Information System, to show how long did it take to house a person, what type of housing are they in, are they meet the chronic definition, which is long-term homelessness, so who are we actually assisting with what type of programs, and really have these measures, and we have aggregate data that we pull out and look at with the homelessness.
Does this also help coordinate services? So
Yes.
nonprofit A knows nonprofit B is doing that, so I need to put my resources
Yes.
here?
Yes, and that's kind of what we worked on. Our community has not done that before. That's why we are behind other communities in the whole homeless management information system. And you have heard me for years really talk about the investments we need to do. And we're at that place right now where we have that platform ready to actually work and function the way it's supposed to be.
Thank you. Any further discussion? All right. So ours 2021-1094. All in favor?
Aye.
Any against? All right. 7 in favor, 0 against. Motion carries. So we have a late file resolution from Councilmember Stiles. It's a resolution urging the Metropolitan Public Health Department Chief Medical Director to require masks be worn by all individuals in public indoor spaces. I'd like to move this. Second?
Second.
It's been moved and properly second. Councilmember Stiles?
Thank you, Chair. First, I want to say that I am so appreciative of you, Dr. Wright, and I've called you and told you many times. You stepped in and really took over and made things run smoothly that had been amazingly hinky. So, thank you. I'm clearly bringing this forth, and it's a late file resolution because we have all seen the data, we've seen the facts. The Delta variant is running rampant through the country, particularly in the South. So for us to sit here and play politics and say, I don't want someone to be upset with me, I don't want business owners to be upset, whatever the ridiculous reason is, we as a body need to place the health and safety of the constituents of this county before all of that. It's not, I mean, it's vaccinated, unvaccinated. If we all put a mask on, it really doesn't matter. Then we're all protecting everyone. And clearly, the message of, hey, everybody, the vaccine works is just not working. The unvaccinated are not turning and running to clinics and going to get their shots. Delta's here, Lambda's on its way. I think as a body, we need to make a statement that we care. We're not playing politics with people's lives. And I would appreciate if you all would consider voting yes on this resolution.
Thank you, Councilmember Stiles. Any discussion?
I am very supportive of mask mandates and very supportive of actually vaccine mandates. I really wish that we would mandate vaccines to work in all of our government buildings because I think it's very important. My concern about the legislation is it's always an enforcement. We did not do a good job before of enforcing the mask mandates that we had in place. And so I wonder in some ways if that does more harm than good because it really doesn't mean anything. Like you say, people who are not vaccinated are not running out. People who are unmasked are not going to mask either. I've gotten, as you know, some emails from constituents who are very adamant about. Yeah, we are adamant.
Have you now?
Very adamant about the fact that they are not going to wear masks. So, I mean, that is my concern about this, that I don't want this to be something that becomes an empty threat, if you will, that then works against, that people get the idea that council is trying to impose things that they're not willing to stand behind and actually stand up to the force of law or whatever you want to call it. So that is my concern about, though I am fully 100% supportive of mask mandates.
Thank you. Councilman Benedict?
Thank you, Chair. And Councilwoman Welsh, I completely hear you, and I share the same concerns. And I thought your email was phenomenal, by the way. If anybody wants to open records request, I'm sure you can get that forwarded to you. But to the point, I actually am supportive of the resolution, and the reason why is because if we believe that masking works, as I believe, I think that we cannot talk about it enough. And we cannot stand together as a body and as a city and as a community and as a region and say that we can't say enough that masking works. Masking works, we know it works. It made an impact last year. It's making an impact again where we're seeing it put in place. We have people constantly attacking people in the state currently. We had a governor yesterday who signed an order saying that you can't make anybody mask. Whether I can or can't make you mask, the fact that I'm continuing to say to you as a public official, as a leader in the community, to say, please wear your mask, please wear your mask. Here's a resolution that has some data, some science, as this resolution has, where a mask is effective. So resolutions are non-binding, right, and in this way, and so I don't see harm in passing it. I think that you also will, I believe, have to suspend the rules on the floor tonight for an ordinance that's similar. I'm supportive of this in committee. I think we'll see what happens on the floor, but to me, the more that I can tell people wear a mask, wear a mask, wear a mask, the better, because not everybody's listening all the time. So with that in mind, I'll support the resolution.
Councilman Porterfield?
Thank you, Chair. Have we heard from the administration on their position?
We've not heard from administration. Mr. Jameson?
Thank you, Chair. The mayor continues to monitor this, and I think the red line between his office and Dr. Wright's and Dr. Jahangir's is probably worn out by now, but monitoring every day the new statistics. As of now, you know the mayor has an executive order that imposes masks within metro government buildings and in metro schools. He also encourages private businesses that choose to mandate masks within their facilities. He also acknowledges, as we all do, that the overwhelming majority of those who are hospitalized with COVID implications or complications are unvaccinated. and that's the rub. As the sponsor herself noted a while ago, the real rub here is the difference between vaccinated and unvaccinated. So as of right now, there is no support for this resolution with respect to mandating a mask for fear that that would direct attention away from the clear requirement to have vaccinations further than we do in the county. There's also the complication of legal challenge. We've heard Governor Lee's executive order yesterday to call mask mandates murky legally is an understatement. Our legal director, Wally Dietz, will be here at the council session to answer questions regarding just how murky that issue is, and that is the administration's word on this.
Councilmember Porter has a follow-up. Then we'll go to Councilmember Styles.
Thank you, Chair. That was, one of my questions was gonna be the legality of it. My follow-up question is to Dr. Jahanger. Have you all taken any position, I mean, are you all prepared to do some form of a mask mandate, or have y'all taken a position on this?
You know, we've chatted about it pretty regularly, even before I knew there was a resolution. It just happens to be the day that Dr. Wright's contract here. In short, you know, the purpose of the interventions we did the previous 18 months have been to mitigate the risk of an infectious process until there's a safe, effective, and easily accessible intervention. We now have that in a vaccine, and I believe, as Mr. Jamieson mentioned, that I'm strongly supportive of businesses and so forth who choose to do it. I believe that kids under 12 should have masks. But I'm, again, speaking for myself, and I guess speaking on behalf of the department, I believe that a mandate, as I understand this I'm not as personally as supportive of, because I don't think the intent of it will be served as Councilmember Stoss, who has been one of the biggest advocates of during this whole pandemic for all of their interventions. So it actually kind of, you know, the fact that I'm slightly disagreeing with you is not typical.
We're still good.
But it is. I'm personally, and I think the department, and I'm looking at Dr. Wright, I don't think we're as supportive either of this as noted.
So,
Councilmember Styles. We'll go to Councilmember Styles. Councilmember Hauser had a question, and then I'll come back to you,
I was
Councilmember
just gonna
Hurd.
make a comment. I was out of town for 4 days. 4 days. I never saw a single individual without a mask inside. Even on the sidewalk, many people had masks on, but inside of buildings, anyone that was bigger than in a stroller had a mask on. So it can be done. I don't really understand why we have such a huge pushback, but it is possible. And I do support the resolution. I would support an ordinance if it came forth as well. You know, I have to stop at a stop sign. My kid has to be in a car seat. All those are things we say are public safety. So anything that has to do with public safety, I'm going to support.
Councilmember Styles.
Thank you. So just to respond to Councilmember Wells. So I think it's dangerous when we say people won't listen, so we should stop talking. So we should stop saying what the right thing to do is. Enforcement in the beginning, when we started talking about contract tracing last year, that was the excuse. We don't have enough people, we'll never get it done. But guess what? We figured it out because we needed to. We need to figure out how we enforce having a mask mandate. These are literally lives at stake. We do not have the luxury of wondering or, oh, I just think people aren't gonna listen, so let's just do nothing. Or, you know, again, the political conversation or worrying about the legality. Dead people do nothing. So I would rather have a bunch of people that are healthy and annoyed wearing masks than dead people because we're sitting here playing the game of everybody who's unvaccinated, please go get a vaccine. But we've had it accessible for months and you still haven't gotten it. And you're not listening to the people that are dying currently in the ICUs that are saying, I wish I had gotten the shot. So this body is here to take a stand. This is a place where we can. This Delta variant is doing extensive damage. Our children are being affected. I respect Dr. Jahanger and Dr. Wright tremendously. I do. I do believe that politics are at play here, and I think that we just don't have the time for that. We need to be focused, and if people want to say, I'll never wear a mask, well, that's their choice, but you can't decide to not wear a mask and then come around others and put others' lives at risk, and that's where we are. So if we're wearing a mask, it's not going to matter if you have gotten vaccinated or not. We're all being inconvenienced. I know, I would love to take a busload, truckloads of unvaccinated people to clinics and just say, here, get that and a lollipop and go on about your business. But we can't. But we cannot put the onus on people's shoulders that did take the responsibility to go and get a shot so that they can be healthy. That's just not fair. So, again, I am pleading with all of you. It is a non-binding resolution, but I am calling on you guys. Please, 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 please. Tell people masks work. I mean, our flu numbers were almost non-existent. Colds, they weren't around. Masks work. They just do.
I'm sorry to intervene, but I don't believe anyone's saying masks don't work. I guess what we're saying, our position from a public health standpoint, the purpose of policies such as mandates and so forth were to mitigate risk until there was an effective, safe, and accessible intervention. And that's all I'm saying. So nothing you said I disagree with, except for nobody here is saying masks don't work. That's my
Oh, no, I'm not saying that they don't work. I'm just saying if we know that they work and it means that we have to go a little bit backwards, because I know the goal is to move forwards and get people vaccinated. But people aren't doing that. So in the meantime, we can't just be out here as sitting ducks while people are not doing what the right thing is. So if we have to go backwards and I'll put masks back on while we figure out how to get the unvaccinated vaccinated, let's do that, because at least that's a step in the right direction.
Thank you, Councilmember Starr.
Thank you.
Councilmember Hurt.
Well, as one, and I agree with what it is that you're saying. I'm one that actually pick up people and take them to go get vaccinated every week. I am one that went out on the limb and talked about fining people for not wearing a mask and doing all of those kinds of things, trying to enforce it. But what we must realize is that we here as a council is limited in what it is that we can do. And sometimes we create situations in where we can't win the fight. So we don't need to be in a situation where it's a mass of distraction, and focus on some things where we really have to do, because this is one of those situations, as much as we would love for each, if I could put a mask on everyone that I see and stick them, I would.
And
But
you
it's,
would.
and I would, everyone, but it's not happening. So I'd rather see us really focusing on the things that we truly have the jurisdiction to effect, and we can continue to tell people to wear masks. We can continue to tell them to get vaccinated, and you can join me every Thursday afternoon. And we have a mobile unit where we go around the city getting people and vaccinating them on the spot. So it's so many things that we can do, but we don't want to misuse our authority as council members in offering policies for the good intent of what it is that we'd like to see happen.
So, thank you, Councilman. So, I'll say this. I am in support of the resolution because we're asking, this is simply, to me, asking the Chief Medical Director if they, at the Health Department, will think about this, I think, right? Mm-hmm. And so I'm in support of this, and I think we've heard from them of where their thoughts are. This is, again, just the body asking. That's what I think. And then that puts it in the hands of our healthcare professionals and PhD to make that decision if they want an executive order from the medical director to make that decision. This doesn't put it into the council body's hands to say we're making that decision for the city. So that's just my point of clarity on this bill and my point of thought on this bill. Or excuse me, on this resolution. Councilmember Glover.
I have to put my 2 cents worth in. I got the vaccine. I don't like these. And I've made no bones about it. I went and got, but in the same breath, if people want to wear it, I say yes. We start mandating, that gets into a whole different world. And so I can't be supportive of this because I have done the things, but yet here we are again. And so from my standpoint, I won't support it. Thank you.
Councilman Stiles?
You did all the things. You don't like the mask. I don't think there's a single person in here. I mean, I don't like wearing this mask. But you did the right thing by getting a vaccine. The people that are not, these are the ones that are out here that are catching this particular variant. If they were getting shots, we wouldn't be sitting here like this. So I understand from a personal philosophy what your stance is, but it illustrates my point exactly.
Well, what you think is right, I may not, and I think there's two sides to it. I think we're sitting in a very cautious place right now, and so that's anyway. I have my opinion, you have yours, and that's all fine.
Councilman Hall?
And I understand the process and the conversation, and somebody who went through it, who was sick, who did not like being sick with that experience, someone who's been vaccinated. I come back away from that part of the conversation just to look at two specific pieces or refocus us on two pieces. What we may want is one thing, but I think we just need to slow down a little bit for a specific reason. One, so the legal side is not as murky, to give us some real authority or definition, and two, to see if between that legal picture being more clear and more conversation from the medical professionals comes to a different point. Because if right now they don't feel that a mandate is warranted, and we still have the legal issue, I think one or both of those needs to be resolved before we act. Right. It's not that we can't at any time or shouldn't. I just think we should be looking toward the administration about trying to get some more clarity or expedite that legal piece, and then see if there's anything that would weigh on the medical professionals to determine maybe we should rethink where we are. Because I think if the numbers get high enough, or we get to the point like we were this time last year, staring down the barrel of maybe some closures or lockdowns or things of that nature, some limitations as a city, then I think then at that point the health department and the medical folks will start to say, okay, in the public's best interest, we know it's not working. We said we would do mandates if there was not an alternative or there was something in place for us to mitigate this. Now we need them to say, despite there being a vaccine and something in place to mitigate, the numbers and the data is where we feel comfortable saying there should be a mandate, and then that weighs. See how one presses on the other? We get legal clarity, it can press on the medical, and if you get medical to the point where they're saying, we understand the legal murky conversation, but our opinion is this is best, then we can have that fight. Because what we know to be true, and unfortunately, yes, this is where the politics gets into it, because that's what we're doing. There's no such thing as binding or non-binding when it comes to repercussions at the state or federal level. And there are always some, even if we're not conscious of them immediately. And we were just talking about that before, about examples of where we've gone down the rabbit hole on something like this before until the ramifications came from the state level. And so I'm not scared or worried about that at any point. I love to challenge preemption on a regular basis. But that's also when we have a little bit more sound footing. So I'm on the fence. I like the idea of the resolution. I can't support any type of ordinance, but, I think we need to think very carefully and say, hey, we've got plenty of evidence, but let's slow down. Let's get the answer to that question and see if we can't create a different level of pressure on the medical professionals to kind of come to our side of this conversation.
Councilman Hurt.
So I recall with the immediate past director of when there was a mandate, there was a problem with the enforcement. what would a mandate do to mental health in terms of trying to enforce it, and what would because I'm sure it's going to be an outcry that you would have to deal with.
From our standpoint, our health department is not an enforcement agency. We don't have the staffing or the reach to be able to do mandates. We found that out last time. We tried, we helped where we could, but really that would have to fall within the police department's purview. There are enforcers, and they're the ones that have that expertise and have a whole lot more people out on the street on a regular basis than we do. I've got a very small department of about 10 people that would try and cover 24 hours a day, 7 days a week, the whole city. So, at this point, that would be the piece as far as just enforcement.
Right.
So I know this is a late issue, and the sponsor will probably need to be in another meeting right now, but Councilmember Porterfield has a response or question.
Thank you, Chair. Question for the sponsor. Would you be open to a deferral on the legislation while we get some of the questions answered with regards to the legality and enforcement?
Intriguing thought. One meeting, okay.
Okay, I move for 1 meeting deferral.
Second.
All right, the motion for,
One comment too, Chair, I'm sorry.
go right ahead.
I would just say, rarely do we get the chief medical director or the interim chief medical director in our committee. And so I think that your input here and the chair of the board's input here was important and something that we don't normally have in committee. So with that in mind, I do support a 1 meeting deferral, and I appreciate the transparency and honest dialogue.
Perfect
open
timing,
dialogue.
that's what it was perfect timing.
So a motion on the floor for late file resolution to require mask mandate.
So what was the purpose of the late file? I mean, because obviously
purpose was-
the urgency that
Yes,
you
because
feel.
our numbers, not that I feel, that the data and the science and the CDC are all talking about that the Delta variant is ravishing us. And so we as a city, I think this dialogue is so ridiculous. We actually need to take a stand. As to Councilmember Hauser's point, she went to Chicago and was there for 4 days, and everyone's wearing masks. They're making effort to stay alive. Why are we debating? Why are we considering not instituting a mask mandate when it clearly works? And if we're desperate, it doesn't
Councilmember
make
Stiles,
sense.
point of order. So I want to bring us back. We are on the deferral motion. Any discussion on the deferral motion? Any addition? Okay. All in favor of 1 meeting deferral? Aye.
Aye.
Any
No.
opposed? No? All right. 1 meeting deferral carries, 6 in favor, 1 against. All right, thank you. All right, thank you. So that is all the items that we have today, but we do have a moment. Dr. Wright and Mr. Sharp is here. They've asked one to be here, and also Ms. Stephanie Kong is here with the Metro Public Health Department. We would like to introduce them.
Let me ask you a question.
Yep.
Are you gonna address the full council? He's
Yeah,
gonna
I'm gonna
give
address
his-
the full council.
So
The
can
Vice
we-
Mayor asked me to do that this
Well,
evening, so
you guys can-
for a matter
So-
of time, would you rather have?
No, that's fine. So I will say this, with this meeting and this committee, I'm going to move forward, especially as we just had a very strong discussion in regards to the Delta variant and our data rising in regards to coronavirus and COVID-19. I'm going to ask at least someone to give a report to this committee each meeting. We did last week, and we do want to do it again this week. But I just wanted to share that with you all. So if we have any questions, I think that for now, in my conversations with Dr. Wright and Mr. Sharp, there's not a need completely for a special call meeting or a full discussion, but I think that this group, the committee, Health and Hospital Social Service Committee, needs to be engaged in this conversation. So as we lead the city and lead the council with discussion and decision, so that will happen. So I'd ask you all to prepare questions or thoughts as we move forward.
Are you saying going back to the once-a-week phone call that we
No,
have?
no, just in committee meeting during council weeks.
Oh, okay, I'm not
Right.
sure.
And if we need to go back to once-a-week phone calls, we'll have that discussion with Dr. Wright moving forward. Ms. Kong, welcome.
Hi, thank you so much. I just wanted to introduce myself really quickly. I'm Stephanie Kong. I'm the new Bureau Director for Health Equity. I was born and raised here in Nashville. I've been away for quite a bit, last over the past decade. Just finished my doctorate in public health and most recently served as the Health Policy Director for Congresswoman Pramila Jayapal. I'm super excited to translate over those skills here back in my hometown. As Dr. Wright and Dr. Jahangir was saying, health disparities were clearly here long before COVID. COVID definitely put a spotlight on it. And I think this Bureau is definitely a commitment and a signal that the Public Health Department is taking health equity very seriously. We cannot move forward in public health practice without centering health equity in everything that we do. We've been talking about health equity for a long time. How do we actually operationalize that? That's what this Bureau is for. I hope this Bureau will be a vehicle for bringing together partners that we haven't normally had at the table, working with council, connecting it strongly with the Metro Public Health Department to make sure that we're actually structurally transforming our communities so that people can live healthier. These are all very lofty, big goals, but it's gonna take all of us, all of your expertise, everyone at the Public Health Department, all the departments across to make this happen. And so please reach out. I would love to work with each of you if you have any policy ideas. Really, I mean, policy is at the heart of that. I truly believe we won't be able to achieve anything in health equity without our policymakers. And so if you have any ideas, please reach out to me. I'd be glad to be a resource. I'm hiring my team right now. And so we will have staff to help you out. And so thank you so much. And nice to meet all of you.
Thank you, Ms. Kong. Welcome. If there's not any burning questions for Dr. Wright, I know that
I was just gonna ask.
Councilmember Evans.
Since you're gonna, when you talk in front of all of us, would you
I
talk?
can give you one, I mean, if you don't mind,
I just wanted to add to your list. Would you also talk, did Dr. Vice Mayor talk to you about the emissions too? Would you share with the whole body the emissions, the Davidson County decision?
Yeah.
Okay.
I've got a little information on the hospitals and
Okay, cool, thank you.
that piece. Sure.
I think she's saying emissions.
Emissions.
Oh, yeah, I'm sorry,
I'm-
emissions.
I'm-
What did I say?
Vehicle
I was
emissions.
going to, I'm really prepared mainly to talk about COVID. I haven't had enough time to really look through
into
the
that,
emissions
okay.
piece. I'll be glad to talk to you offline.
Okay, sounds good, thank you.
Thank you. Any additional information requests? All right. Thank you. Meeting adjourned.
Thank you, Chair.